they will give him PPPs for health infrastructure management. Then they will say, generally, they also ensure availability of all hours, quality health provision at primary level by scaling up the network of practice. They say they will complete the ongoing Agenda 111 project. And I want Dr. Bawumia, Sunday, God willing, if I get opportunity to ask him a question or some of our colleagues go, we should ask him how they will fund it. The estimators have told you is about $1 billion US. One hospital, according to President Akufo-Addo, when he came to trade, is $16 million. $12 million for the construction and $4 million for medical equipment, making $16 million. The signature one, which is the one at trade, which was used to do the symbolism for the entire 111, is just about 80% according to the master document as of March 2024. March 2024. It was 79% to be exact. So that's just about 80%. We need to know which ones are they completing. How many of them?
No, but if you look at it, I understand you. But if you look at the manifesto, what they're saying, they didn't say they're going to complete some of them. It says complete all Agenda 111 projects.
So where's the money coming from?
Exactly.
It's about $1 billion. It's about
so for me to be real, because again, it's not just about the health sector that needs attention. All the sectors need attention. Yesterday when we're talking about education, for example, and what they want to do from the KG through the creche and all that, where they want to have monitors and stuff like that, it all costs money. So if you're telling us that you want to complete all these Agenda 111 projects, how feasible is it? And like you're saying, where's the source of funding going to be at? But for me, to be real, let's say looking at how much a unit costs. Let's say complete about 20 or 30, and then the rest something. What if they want to complete all Agenda 111 projects?
You know, 30 is about $480 million.
You know?
Yes, $80 million. I mean, because it's 16 million. So if it's 30, 16 by 10 is what? 160. So 160, 6 is what? 18, right? 12, 18. So that's 480 million. Yes. So that's what I'm saying that would that come to price? And Dave, beyond Agenda 1, you know that inherently there are some that are not 60 million.
Yeah.
For example, we were promised an on psychiatric hospital
for the northern sector.
For the northern sector.
Yeah.
Then we were promised 6 regional hospitals. That's why it was 88. Then they added on to. Then there was also some renovation projects to be done. I have not seen any shortcutting at Onye. So if you open the phone and you stay at Onye and there's a psychiatric hospital ongoing, you can tell us. Because I know Ejeso is not part of the Agenda 1, if I'm not mistaken. For the 16 districts in Ashanti, I don't think Ejeso is part. I don't think Ejeso is part. The closest Ejeso is the one at Kokoben, which is in Ofurukrum constituency. So the region, they said they will complete all regional hospitals. And the regional hospitals include the Eastern Regional Hospital in my place of Koforidua, that building. We need to check it. And the La General, when you go to your funeral, check for us. As you weep, then you know. Then they say that they also complete the maternity and children's block at the Konfanoti Teaching Hospital and also at the Kolebu Teaching Hospital. So meaning that there's also an outstanding maternity block at Kolebu. Then they said that they will establish new sub-specialist centers in teaching hospitals. So meaning that if Ghanaians find favor Dr. Mahmoud Bawumia, by the end of his tenure, we must see some specialist centers at Konfanoche, particularly in the Ashanti region. Because he said teaching hospitals. Ashanti region has a teaching hospital, which is Konfanoche. Then they said that they will do home care services, ensure appropriate legal regime and policy guidelines for the establishment of home care, nursing homes and rehabilitation centers, including caregivers, support provisions. So they are coming to replicate what happens in the UK and the US, where elderly people or where people who cannot go to the hospital giving home care services. Dave, amount for Kwabri, I don't know where. Would they be doing it in Ghana?
That's what the manifesto is saying.
Yeah. And he says that there will also be medical tourism. They will develop a policy to make Ghana a strategic medical tourism hub in the region through PPP where appropriate.
But is it possible that when you're talking about some of these things, they give us timelines to it? And I have always said this, and I'll say it again this morning. Forgive me if it sounds like a broken record. And I'm referring to Professor Frimpong Boateng when he was doing this cardio...
Thoracic center.
You know, the cardiothoracic center, where people are coming from the US, Germany, and other African countries to come and get their heart surgeries done here in Ghana. So with that, when the man was doing so well, what we should have done was to have had other aspects of medicine, you know, so that more people come into this country. When they come, they will sleep in hotels. They will be on admission. They will be treated. They will pay. And then it helps boost our economy. These are all fine ideas. Implementation is where my concern really is. But let's see how it goes. I mean, they said they want to do something about medical tourism. Let's see how it goes.
Yes. And Dave, drone delivery service. You know that Ashanti region have one at Mampong. They said that they will establish 2 additional centers in Upper West and Savannah regions. Specifically, Funsi and Kintampo. Is Kintampo in Savannah region?
I need to cross-check. At Funsi and Kintampo, we'd have to cross-check.
Kintampo no in Bonahafo?
Kintampo, I think so.
Google it out for us whilst we continue.
But the medical tourism.
Yeah,
first,
because I think they need to be because Savannah region, because they say Funsi and Kintampo. So I don't know where Kintampo is. I think per my geography, if it's intact, it's Bonahafu region.
Yeah, I want to know what is the doctor-patients ratio in Ghana. That, have we met it for us to think about medical tourism for people to come and add on?
Well, it's a specialized area. It's a specialized area. I mean, for example,